Coming up in this bulletin, President Kufu ABA appoints COP Christian Tonu as Deputy IGP in charge of operations. Also, senior high schools across the country in imminent danger of running out of food as suppliers warn they will be forced to sleep in the offices of the implementers if arrears are not cleared.
Indicates that over 6 billion is being owed to companies, individuals, and organizations in relation to free senior high school.
So we'll bring you details. As you saw, the minority is taking on President Kufu ABA for its inability to settle 6 billion cedis owed various suppliers to the free SHS program. And latest Afrobarometer report, a significant decline in Ghana's democracy sees as they attribute it to economic crisis, mismanagement, and corruption, sparking outrage among citizens.
And they also are more inclined to support authoritarian forms of government, especially military rule.
Now, President Kufu ABA has appointed Commissioner of Police Christian Tonu as the new Deputy Inspector General of Police in charge of operations. This appointment follows the advice of the Police Council during its meeting on Wednesday, where COP Yonu's exceptional credentials and dedication to duty were acknowledged. The release from the presidency reads, I'll share with you details of the particular statement there. And it says, the President of the Republic, Nana Addo Dankwa Kufu ABA, has appointed Commissioner of Police, Mr. Christian Tonu, as a new Deputy Inspector General of Police in charge of operations. It continues to say that the President of the Republic, Nana Addo Dankwa Kufu ABA, this appointment is pursuant to the advice of the Police Council at its meeting held on today, Wednesday, 17th July 2024, during which COP Yonu's exceptional credentials and dedication to duty were acknowledged. COP Christian Tonu is a distinguished law enforcement officer with a career spanning over 3 decades and has held various key positions within the Ghana Police Service. It again says President Kufu ABA extends his heartfelt congratulations to COP Christian Tonu on his well-deserved appointment and wishes him the very best in the discharge of his duties. So that is the details of that particular statement coming out of the presidency. Now let's bring in Dr. Bona, who is a security analyst at the back of this particular appointment. I'm grateful to you for joining us. Now, you've been in this space for quite some time. Does this appointment change anything?
Oh yes, good evening. Congratulations to COP Yohonu. For those who know Yohonu, he's a fine police officer, a gentleman. Call him that way. I have worked with him closely in the past, and so I know he is very disciplined, and is one of the people who can say he knows what he's about. But with regards to specifically to answer you whether the appointment changes anything, question I would ask is that usually they would say, a deputy IGP is appointed, but the moment you begin to have situations where a deputy IGP is appointed and is assigned a certain specific, duty, operations. The police already, they have a Director General, in charge of police operations. And so to have a Deputy IGP appointed in charge of operations, then the question, some of the questions that could come up would be, are we going to have other deputies? Because then that would be an anomaly, and more so when we are going into the 2020 elections, 4 months into elections. The conventions all over the world, in all democracies, you don't tamper with the security architecture, i.e. right from immigration to the military, including the police. You don't tamper with it, because then that could spill doom for everyone. Okay. Trump attempted to do it before he lost that election, and his advisors stopped him from the White House from doing that. And so these are things that some of us are watching closely. I don't want to believe maybe the president is intending to do any more appointment, but that would not be good for democracy, if you ask me.
All right, grateful. Let me bring in now James Agaga, who is a ranking on Defense and Interior Committee of Parliament. Grateful to you for joining. Does this come to you as a surprise? Is this even a new position that has been created?
Well, thank you. Let me start by congratulating COP Christian Tete Yohonu, who is a very hard-working police officer who has acquitted himself very well while serving his country. But that said, let me quickly respond to your answer. I mean, the position of Deputy IGP is nothing new. I mean, if you look at the police service, it's a hierarchical organization. There's clearly the position of Deputy IGP after the position of IGP, and directly below the GP2, that is the Deputy IGP's position, you have the Commissioners of Police. So it's not a new position, except that for a very long time, nearly 8 years since this current president assumed the reins of governance in this country, this is the first time. Is it? No, it's not. But this is one of the few occasions found it necessary to make an appointment into that position.
But is this part of the recommendations that your committee that worked on the investigations into the leaked IGP tape recommended?
No. Our committee did not make any such recommendation at all. It was not part of our terms of reference. We made certain recommendations about policing in the country, but that did not include a recommendation for the position of Deputy IGP to be filled.
I'm grateful to you, James Agaga, for joining. He is ranking on the Defense and Interior Committee of Parliament. Away from that, and still staying in Parliament, the minority in Parliament say government must immediately settle about 6 billion cedis it owes several contractors and suppliers in relation to the free senior high school program. According to the group, the supplier of the tablet for senior high school students is currently owed in excess of 300 million cedis. Speaking to journalists in Parliament, minority spokesperson on education, Peter Nochu-Koto, warned that several of these businesses could collapse if government reneges on its responsibility towards them.
I can say that information available to me indicates that over 6 billion is being owed to companies, individuals, and organizations in relation to free senior high school. For instance, this year they launched the tablets for senior high schools. It's a very good program. This is because it's going to reduce the burden on the printing of textbooks. And our children, how they handle textbooks. I mean, every 3 or 4 years we have to replace them. So the idea is fine, and we support it. Even if you look at NDC's manifesto for 2020, it was there. We even added tertiary institutions. So we support the idea, but we should do it at a time where resources are available. You have asked somebody to do this or supply the tablets, but 1.3 million, that is 1,350,000 to cover all students. You are not paying for it. Meanwhile, the man has gone for a loan, and it is at a cost of 337 million Ghana cedis. You have not paid the person. You have paid him less than 10% of the cost. If he had gone for a bank, a guarantee or whatever, how would the person pay? So, as a minority, we are concerned that if we do this, we are killing businesses of individuals and companies in the country. So there's a need for us to intervene on their behalf.
Owes WAEC some 224 million cedis despite paying some amount for the BC. With WASI on the horizon, the minorities say that amount must be paid immediately.
Government still owes WAEC. As part of the free senior high school policy or program, students are not to pay for WASI. Government pays everything on their behalf. The examination is about to start in August. However, government has not released any money to WAEC. Now, they owe them 2024, they owe them arrears of 2023, and 2024, they have not paid anything. Total of 224 million Ghana cedis. That is what they are owing WAEC. So WAEC is unable to talk again because we had to talk for them before money was released for the BEC. And we shouldn't be going that tangent. Whatever is due to an institution or an agency that is to perform a function on behalf of government must receive resources early enough to plan ahead.
Let's bring in Kbu Amed, who is PRO for the National Food Suppliers Association. Kbu, I'm grateful for you joining. Now, how many months exactly are you owed and how much is it?
Yeah, thank you very much for this opportunity. We are looking close to about 200 million Ghana cedis. This is an amount owed the suppliers of the year 2024, which also includes the suppliers who are under commodity exchange.
Okay. And with this, what are you doing to get payment for the monies owed you?
Well, we are still in the initial talks, all in an effort to get our money paid to our people. But what is intriguing is what GCS is subjecting suppliers to is quite alarming. For the 2024 supply that we did, we were paid based on last year price. So at the time, beans was 1,100 cedis. Today, beans is 2,000 cedis. But as we are being paid, we are paid based on the old price. After that, we were deducted withholding tax of 3%. Then later, GCS, let me speak, I speak for the suppliers, but let me give a classical example of my case. They are deducting me 200,000 Ghana cedis over a claim of an audit report that indicated that I had supplied short weight. My brother, at the school centers, we do delivery of these foodstuffs.
Okay.
We have headmasters who check the quantity we have brought. We have storekeepers who also check their quantities and append their signatures. We have the accountant or the bursar who also attests his signature, all attesting to the fact that a supplier has brought the required quantity and the required quality. Where there's a shortfall, a supplier is invited to top up before the way bill is given.
So you disagree with that? You disagree with that? Now, you're also warning government that you would do something, you would act if it doesn't pay you. When is this action going to take place? And what exactly are you going to do?
We are still in the talking stage. We just hope that it doesn't get to that point. It shouldn't take us coming to radio or TV for government to get us paid.
Okay. We
should all understand that this job that we do is not as if government gives money in advance for us to go and procure those things.
Okay, Amed, I'm grateful to you for joining us, and we'll keep an eye on this particular development. Now, away from that, the anti-LGBT bill will remain in Parliament for a while longer as the Supreme Court has deferred its ruling on an interlocutory application that aimed to prevent Parliament from transmitting the bill to the President. The two applicants, Richard Delasky and Dr. Amanda Odoi, contend that the bill breaches some provisions of the Constitution and should not be transmitted to the President. The five-member Supreme Court panel, chaired by Chief Justice Tonu, in deferring its ruling, indicated it will give the decision in injunction application and the substantive application together in an early trial. Head of our Legal Affairs Desk, Richard Kojunyako, was in court for us and has more in this report.
So it was a huge day in court. The expectations of many was that they were going to hear whether the Supreme Court will grant the injunction application filed by journalist and lawyer Richard Delasky and Dr. Amanda Odoi, a researcher with the University of Cape Coast. The two were seeking to bar Parliament from transmitting the anti-gay bill to the presidency for his accent or otherwise. But the Supreme Court says they are deferring their decision until the final determination of the substantive suit.
Substantive suit together, enabling this court to deliver a more informed, comprehensive and just decision that accounts for all relevant circumstances and factors in this important matter. Such a unified approach will further provide context and clarity, and also afford a clearer understanding of the issues raised in this interlocutory matter and their impact on the main suit. Having therefore diligently analyzed all the material processes on the record in this instant application and listened to oral submissions by learned counsel for the parties, our decision is to reserve our verdict on the interlocutory application until the final determination of the substantive suit, at which point we will render a comprehensive judgment that addresses all aspects of the case, including the current application for injunction. In conclusion, the decision of this court on this application for an interlocutory injunction is hereby deferred to abide the outcome of the determination of the substantive suit.
Lawyer for Richard Delasky indicated that the injunction application still holds and they are happy that that matter of course has been made because they felt that some of the pleadings that found place in the injunction application were the same or similar to the pleadings in the substantive matter.
We say that invariably, indirectly, it is still restraining any party from doing anything contrary to the demands of the application. Can't do it insofar as this matter is pending, otherwise it will amount to contempt of court, to the best of our understanding of the law. When the court speaks about an early trial, in effect what it means is that it will speed up the process towards the determination of the matter so that this whole issue of injunction before final determination will no longer take a center stage.
The Attorney General insists that once there is an injunction application pending and no determination has been made, Parliament can not transmit this bill to the presidency.
Once that the court things can be better dealt with in a substantive action. And it's permissible for a court to do that. There's nothing unusual at all. The court actually referred to an existing rule on injunctions. And so I think that the court is fair in coming by that approach. I mean, if at this stage the process have not been transmitted, and there must be a reason for that. The reason is that there was this application for interlocutory injunction pending, and the court has still not disposed of the application for interlocutory injunction. The court said the determination of that application for interlocutory injunction should abide the determination of the main case, and for that matter, it is reserving its determination until the main action is heard. It tells you that the application for interlocutory injunction is still pending, has not been disposed of. And so I think that would be the proper course to take. I still have to follow my processes, and that will be the first point for me to take. So it's a matter of complying with the rules of court. I have to comply with the rules of court first before you think about an expeditious hearing. So the question of expeditious hearing of the main case does not arise at this stage until all processes have been filed and the parties are ready to move forward. You heard counsel for the first defendant even talking about an application for a consolidation that has to be made, and that has not been done. So I do not think that there's a need for us to be considered the question.
From the Supreme Court, my name is Richard Kwejo for Joy News.
Now, the verdict of the latest Afrobarometer report has positioned Ghana among countries in Africa witnessing a significant and continuous dip in democratic scorecard. This trend has been attributable to the economic crisis, corruption and mismanagement, which is breeding anger and dissatisfaction, especially among the active population. There's more in this report.
Africa's democratic progress has faced a major challenge. Since 2020, military interventions have ousted elected governments in 6 countries, while 3 presidents have bypassed constitutional term limits to secure third terms. Moreover, some leaders are subtly undermining democracy by consolidating power, weakening checks and balances, and intimidating political opponents. Afrobarometer, which has tracked African citizens' democratic aspirations and experiences for 25 years, reveals a troubling trend. According to Boniface Dulani, Director of Service at Afrobarometer, the growing discontent among youth regarding democratic governance does not augur well for the future of democracy in the sub-region.
It's true that the youth, I think, are more dissatisfied with the democracy, and they also are more inclined to support authoritarian forms of government, especially military rule. I think part of the problem here and the challenge, especially for the youth, is that when you also ask our respondents, what are the most important things that they want the governments to be addressing? And unemployment is, I think, a big problem, and especially for the youth. So they are looking at alternative forms of government that can help to deliver on their needs, and especially on creation of jobs.
But Ghana has been positioned among countries in Africa that are witnessing a continuous dip in their democratic scorecards. Boniface Tulani recommends immediate pragmatic measures to avert any Kenyan-like situation in Ghana.
Well, of course, I mean, this is a very big continent, so as the report highlights, there are differences from country to country. Some of the countries like Ghana, we've seen a huge drop in satisfaction with democracy. And I think the reasons, as we know many of them, the economic situation in Ghana in recent years has not been particularly great. The youth have, as I've already said, like their colleagues elsewhere, are not happy with the amount of jobs that are being created. So,
barely 5 months to the general election, immediate past EC chairman for Malawi, Dr. Chifondo Kachali, is advising the Electoral Commission of Ghana to purge itself of any suspicion in the conduct of the elections.
I think as election management body, it's always important to remember that credibility is very important. So everything you can do to ensure that you create a level of confidence in the stakeholders about the integrity of the processes that you're managing can never be underestimated. And one of the ways to do that really is just being transparent and open about everything you're doing. Sharing information, and people should be aware of what's going on and why things are happening a certain way, removes suspicion, because where there's too much suspicion, it gives rise to a lot of conspiracy theories. Where there's transparency and accountability, people have information to actually make informed decisions.
And collaborating with...
This Afrobarometer African Insights 2024 Democracy at Risk, the People's Perspective Report, is the first in what will be an annual series on high-priority topics to distill findings from data spanning more than a decade, including the latest round of nationally representative surveys in 39 countries, representing the views of more than 3/4 of the continent's population. For Joy News, Samuel Mbura, Accra.
Away from that, the collapse of 2 bridges linking Kulgona and its localities in the East Mamprasi municipality of the Northeast region has forced residents there to resort to dangerous means to access essential public services in other parts of the region. The 2 bridges broke in August last year, completely cutting off the area and isolating the tribal residents who are already struggling with the consequences of long-standing state neglect. Following the start of the rains, access to education and healthcare facilities out of the communities have become a challenge, and economic activities grinded to a halt. In an interview with Joy News, the resident called on the government to come to their rescue.
The farming community of Kulgona in the East Mamprasi municipality is located less than 40 kilometers east of the regional capital, Nalirgu, situated on the extreme left of the village of Kolemvai along the Nalirgu-Bintiri road. The road that runs through Kulgona is being seen as the shortest alternative to travel from the regional capital to the easternmost parts of the region, including the Yunyo and the Cherponi districts. The road is, however, rarely used by motorists due to the lack of a bridge over a river at the eastern outskirts of the community, which often renders it immotorable during rainy season. Since the rains began, school children on this part of the community have been asked to stay at home. Their parents are worried and plead with the authorities to fix the bridges. We can't allow our children to continue to risk their way to school every day. We can no longer access healthcare facility in Nalergo.
We are appealing to government to come to our aid to refill it so that people can access healthcare, and students in particular can also pass through the bridge to school.
The situation has also severely impacted socio-economic activities, with startups and small businesses being threatened, whilst access to the most basic needs such as food items and pharmaceutical products becoming a challenge day by day in the community.
If the rain, if I went to seconds or if I want to Kumasi and bring my ATM, in fact, we can grab the labor.
On a regular market day, you see many cars here. And as I speak now, no car can pass there.
The chief of the community said his people and many other Concomba communities were yet to benefit from the creation of the new region. The school building is in shambles, and the marketplace is nothing to write home about. We have been neglected. We haven't benefited. Nalergo for Joy News, Elias Sutanko reporting.
This is still the Joy News Prime. We'll take a quick break. We'll be back with more. Please do stay. Welcome back from the break. Now, despite a growing number of cases of dengue fever, scores of residents in the Central and Greater Accra regions claim that they are unaware of the symptoms, mode of transmission and preventive measures of the unusual clinical malaria cases known as dengue fever. As of today, about 36 cases have been confirmed across the country, with Eastern region alone recording over 11 cases, and some cases also confirmed in parts of the Central region. Listen to some residents of Accra and Cape Coast calling for intensified public education.
Asthma is a chronic inflammatory disorder of the airways characterized by
the fever you are talking about. I haven't heard of it. And I don't know, I kind of know that mosquito causes malaria, but I haven't heard of this fever. I don't know the name of the fever. Dengue fever, yeah, I don't know. I haven't heard of it, but I will make my research. As a student, I have to make research on them. So I make my research and then know how much I can prevent myself from such diseases like that. And also tell my friends about it, since it's new to me right now. Yeah.
About the dengue fever, I don't know about the dengue fever, but then I know about malaria, and I know that malaria kills a lot. Yeah, so I'll go and research about the dengue fever and know what I'll do to protect myself from it. Yeah.
I hear about this thing before, and that's I think this week that I heard that kind of a sickness before, but I would say I'm not aware. I'm aware too.
I'm not aware of it. I haven't heard of it. I know of the old malaria, the malaria that, I mean, when mosquito bites you, you have malaria, and you go in for treatment. That's all I know. But for any new one that has come now, I don't know anything about it.
Meanwhile, Bona East Regional Director of Health Services, Dr. Fred Adomako-Boateng, has also cautioned the public to be on the alert for dengue cases as a tropical disease. Now, Anna Sabet has more in the following report.
The Ghana Health Service, through a press release, announced that there is an outbreak of dengue fever in Ghana following the confirmation of 9 cases in the eastern region. The disease, which is a viral infection that spreads from mosquitoes and caused by dengue virus, is said to be prevalent in tropical and subtropical areas. Bona East Regional Director of Health Services, Dr. Fred Adomako-Boateng, described the disease as a malaria-like illness.
These are some of the common signs and symptoms in the uncomplicated ones that you see. One of them is fever, where your body temperature is more than you always have. If you go and you test and the RDT is negative, it's negative. It's negative. Look for what is causing that fever. And that is what dengue and all the other are telling us now. That the era where every fever is managed as malaria is no more. Then we are also packed. Oh, this my malaria is malaria. I have to get injection. This my malaria is, when we don't even test, you are saying that you have malaria.
As it stands, the Bona East region is without a single confirmed dengue fever case. However, health authorities in the area are on high alert about the condition and are instituting measures capable of curbing an sabit. Joy News.
So that's, a report there. But let's still stay in the health sector because the World Health Organization estimates an asthma country incidence rate of 1.5 in every 1,000 per year for Ghana, compared to rate as low as 0.3 per 1,000 in many parts of the world. Now, despite widespread awareness, misinformation on asthma conditions, including treatment and management, persists. Clinton Yeboah explores improved education, dispelling the common myths.
Asthma is a chronic inflammatory disorder of the airways characterized by respiratory contraction and mucus plaques that limit airflow. The condition is accompanied by a history of recurrent respiratory symptoms such as wheezing, shortness of breath, chest tightness, and cough that varies over time and intensity, along with variable airflow obstruction. Across the world, asthma affects 334 million people. A study on the burden of severe asthma in sub-Saharan Africa in 2024 reviewed the prevalence of asthma is estimated as 7% and 9.6% in rural and urban areas respectively. In Ghana, over 46,500 incidents of asthma are recorded yearly. Parents of asthmatic children know about the condition, but a trip to the Kbu Teaching Hospital pediatric clinics revealed a lot of alarming yet growing fallacies parents are confronted with from outsiders and non-experts. Here are parents who almost fell prey to the hearsays.
Can't say me back to hospital so asthma. We are a say and fanenko a young fanen to a drew so we yes I been who I say BC. Nema and unfortunately Rama got a munsu, which I'm just a meeting yes I got a munsu. I'm a plana no ma. These misconceptions yield dangerous apathy that may affect the control and treatment of asthma. A pediatric resident at the Kbu Teaching Hospital, Nana Abena Owusu Mensah, says it can cause the death of patients.
Sometimes for 5, 10, 15 years, you will not have any asthmatic attack, and it doesn't mean that you are cured. We don't cure asthma, but we can control it to an extent where the patient can be disease-free for a very long time. So usually when it gets to the place where the disease is controlled, people tend to stop taking their reliever or their control medications and sometimes come in with severe disease and basically come in with life-threatening disease that may take their lives.
The Pediatric Society of Ghana, Ashanti Division, together with the Department of Child Health, School of Medical Science at the Kwame Nkrumah University of Science and Technology, and the Directorate of Child Health, Kbu Teaching Hospital, has recognized the myths. A sustained parents' engagement at the Kbu Teaching Hospital in commemoration of the World Asthma Day, themed Asthma Education Empowers, has assembled parents and guardians to be educated on proper asthma management mechanisms. Dr. Sandra Kwatona-Wusu is a pediatric pulmonologist and a senior lecturer in the Department of Child Health, KNUST. She dispels beliefs that asthma is contagious and can be cured.
Some parents feel that asthma should be cured, but from medical science, we know that asthma is a chronic disease. It's a long-term disease. Asthma is a non-communicable disease. So if you live with somebody with asthma, the person would also not get asthma just because you are living with the person. Asthma. The long-term treatment for asthma is not salbutamol, it's not Ventolin. The blue inhaler is good for emergencies, but to control asthma, to manage it effectively, to bring down the symptoms, we need to use other medications, which we call inhaled corticosteroids.
The newly informed mothers and guardians who attended the session expressed their confidence in managing their children's asthma conditions with the education they have received. Territorial Manager for Cipla Pharmaceutical Limited, James Makion Akon, says the heightened education will save lives.
I decided to partner Dr. Sandra in this worthy cause to care for life, as that is our ultimate goal. We are not just makers of medications or medicines, but then we also go beyond just making medicines, but then also making sure that we care for life as well.
Now, in an effort to boost health service delivery and expand accessibility, President Kufu ABA has assured that 11 district hospitals and 1 polyclinic will be completed before the close of 2024. Speaking at the commissioning of the Adanse Former Hospital in the Ashanti region, the president indicated the project forms part of his agenda for the transformation of the health sector. While indicating his commitment to establish hospitals for the newly created regions, the president underscored the need to complete various district hospitals alongside the Agenda 111 initiative. Nana Boachi Yadom has more in the following report.
President Kufu ABA commissioned the 9-year-old Adanse Former Hospital, which was started by the John Mahama administration in 2015. The project, which was expected to be completed in 2017, was hit by some financial constraints. At the commissioning of the hospital, President Kufu ABA indicated his government's commitment to completing stalled hospital projects. He says 11 district hospitals and 1 polyclinic are expected to be completed by the end of the year.
By the end of 2024, we'll also complete several significant projects, including the Urology and Nephrology Center of Excellence at the Kbu Teaching Hospital, the construction of 11 district hospitals and 1 polyclinic in the Ashanti, Eastern, Greater Accra, and Ahafu regions, and various treatment and holding centers. These efforts align with our commitment to achieving universal health coverage, guarantee improved and more efficient healthcare services for all Ghanaians.
Now, the Hill Kofu Anoche Hospital project timeline, originally estimated to be completed in 24 months, will be extended to 36 months. The new development follows functional constraints as the Kofi ABA Teaching Hospital remains in operation during the renovations, which affected speed of work. This was disclosed during Kwame Nkrumah University of Science and Technology and College of Health Science donation of some 125,000 cedis and expertise to support the Hill Cath project aiming at renovating the 70-year-old Kofi ABA Teaching Hospital. Here is a report by Clinton Yeboah.
One of the major challenges faced by health authorities in the Upper West
Apologies for our inability to bring you that one. We'll bring that in our subsequent bulletins. But the lack of infrastructure, particularly accommodation for essential medical staff, is affecting the quality of healthcare in Wa West District of the Upper West region. Many doctors often refuse postings to this deprived area due to inadequate housing. Recently, a doctor almost declined a posting, but thanks to the effort of the local MP, Superintendent retired Peter Lanchini Tobu, an old bungalow was renovated and furnished for the doctor's use. Join us, Upper West Regional Correspondent Rafiq Salam, report from Wichau.
One of the major challenges faced by health authorities in the Upper West region is the refusal of critical medical staff, especially medical doctors, to accept postings to the region. The few that sometimes accept the postings later decline due to unavailability of decent accommodation for them. The Wa West District, for example, over the years had several medical doctors posted to the district, but turned down the offer because of lack of accommodation. Concerned about the health of the people, which he sees as one of his priorities since becoming a legislature, Superintendent retired Peter Lanchini Tobu decided to renovate and furnish an old abandoned bungalow that was constructed by the Wa West District Assembly, which was in deplorable state at a cost of 90,000 Ghana cedis.
When I got the information about the fact that we had a medical doctor posted to the facility, and we were likely to lose a doctor because accommodation was a problem, whatever it would take for me to support the district health directorate and support the district assembly for us to renovate this facility to keep this doctor here, I will. And that is exactly what I've done, and that is why we are here today.
Medical superintendent of the hospital, Dr. Benjamin Amiyori, was grateful to the MP for the support to the hospital over the years. Wa West District Chief Executive Vide Dorothy spoke of the commitment of the government to improve the health sector of the district.
Another activity that was undertaken by the West Member of Parliament, Superintendent Retired Peter Tubu, was at the West District Hospital, where
British actor Kofi ABA is making a name for himself in the entertainment industry with his impressive performances on screen. Born and raised in the UK, ABA has always had a passion for acting and has honed his craft through the years of dedication and hard work.
I'm an actor, I'm based in London, and predominantly worked in a lot of theatre. Also now working in film, TV. I've even worked here in Ghana a couple times. Well, not worked for like Ghanaian productions, but shot in Ghana. I kind of caught the bug in school. So I was doing GCSE drama at the time. It was just before I was going to do my drama stuff, and then I got told to be in this production that the school was doing. I got involved, and I loved it. And ever since then, a friend of mine brought me to this Saturday class, kind of acting class. And then from there, I got a job, and then I went to like a performing arts college. Then I went to like a drama school, and then I just started working professionally.
This solid educational background has equipped him with the skills and confidence to take on a wide range of roles. Eric has appeared in several notable productions, including Blue Story in the industry. Eric is proud of his Ghanaian heritage and continues to be involved in the country's entertainment industry.
I'm still, it's like I don't really want to talk too much about it, but I'm still working on telling a story about Yasantua.
Okay.
Because for theatre and cinema, I'm still working on it, and it's definitely going to happen. But these are the stories that I want to tell. A good friend of mine that's here, Eddie Nate.
Yeah?
Amazing guy.
Yeah.
Incredible guy.
Yes.
He writes, directs, produces.
And acts.
He was helping us working on Hero. That's how I met him.
Oh.
That's how I met him first. And whenever I've come out here,
You reach out to
reach out and we link up or whatever. But it's people like him that I want the best for, because he is an amazing guy. These are the people that I want to work with in Ghana.
Okay.
To produce incredible films.
Kofi ABA is a shining star in the global movie industry, and his Ghanaian affiliation is a source of pride for the country. His impressive performances and dedication to his craft have earned him recognition and accolades. We look forward to seeing more of his work in the future.
Sad. But this is beautifully done.
What?
This is beautifully done. They're together, releasing a statement.
Yeah, that they're breaking up.
Exactly.
Yeah.
When you break up, you're not enemies, you're friends.
Of course, yeah.
And this is the beginning. This is the best way to do it, you know.
Big up Steve Stormzy.
Yeah, you've done well.
Yeah.
So like people will say you talk your partner to understand, like the matured way of breaking up. You talk, both of you talk and decided no, because of ABC where we are, we can no longer continue, but we're not enemies.
Grace, you're still married. You know a lot about breakup than I do. But we're so grateful that you could join us this evening. We're grateful that you'll come back here tomorrow for Throwback Thursday.
Exactly. And we're grateful to Dinah for that music.
To Dinah for the new song. We really appreciate it. Oh, Jesus Christ. Bless you all.
All right.